Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you are watching my YouTube channel. Today's topic is of high yield pediatrics is constipation in children, which is very, very common. Parents are really worried about their children's symptoms, and constipation itself is a reduction in the amount of defecation, meaning stooling, which could be reduced in frequency or quantity, and also leads to symptoms. The symptoms could be local and could be abdominal. Because of the hard stools, the kids can have pain in their anal area when they are pooping or stooling, and they could have abdominal pain, cramps, urinary tract infections because of the pressure of the hard stools pushing on the bladder outlet, causing stagnation of urine and causing UTI or ascending infection from the urethra. So usually constipation is also associated with another condition which is called encopresis. Encopresis is that when you have hard stools in the rectum in the children, so the hard stools they block the stools from the top coming out, so the bacteria grow in them and they cause liquefaction or conversion into a liquidy or liquidy stuff, and that kind of leaks around this hard ball of poop or stools in the rectum, and that intermittent leakage of this fluid like stools causes annoying symptoms because kids who are 6 or even 8 years old or around this age may have soiling of their clothes and bad smell coming from them, because this liquidy stool that leaks out intermittently is really of that smell. So this brings down the confidence of the child and is like a psychosocial stressor for the whole family. So constipation itself is fairly common during the childhood, and the reason could be either organic or functional. There could be something really serious, or there's something that needs to be treated, or it could be just a behavioral thing. For the normal stool pattern in children could vary from the age. Breastfed kids can stool up to 4 times per day. By age 4 months, the breastfed children are similar to non-breast children as far as their stooling goes, and by 1 year they could have 2 times per day normal stooling, and by age 4 years they could have once daily stools. However, in the neonates, in the first few weeks to months of life, kids may not poop up to, reported in literature, up to 1 week. But as long as the child is tolerating fluids, gaining weight, growing fine, it's not a serious problem. Breastfed kids, like I said, they may have more frequent stooling up to 4 months of life, and then it gradually is similar to non-breastfed kids. The functional fecal retention is very, very, very common. In this, because of the lack of the fiber in their diets, the stool gets retained in the rectums, it becomes hard, and when it comes out, it's painful. Sometimes it could be painful diarrhea. But the reason people develop this functional retention also is, other than hard stools coming out and kids are really, really scared to poop, there could be also severe diarrhea which is associated, and local excoriation or damage to the skin of the anus happens, due to which when the child stops having diarrheal stools and regains the normal stools, they have pain when the anal sphincter is stretched. There could be also painful diaper rash which can cause a similar problem. And physical abuse in children can also lead to fecal retention. And due to this, this vicious cycle, that once you have painful experience during stooling, the children tend to start holding on to their stools, and which progressively worsens the problem. So it's like a snowball effect. One painful experience leads to holding of the stools, which become hard, and when they try to evacuate or poop, it hurts, and then they want to retain more, and the problem worsens, and can they develop subacute type of intestinal obstruction with associated vomiting. The clinical features you would be, other than withholding, and having large amounts of retained stools in the rectum, kids can have the secondary anorectal distension. So the rectals become too big, it retains large volume of stools, and rectum is the last part of the large intestine. And the soiling is another. The onchoporesis is a very, very cumbersome problem, like I stated earlier, which will be part of this functional stool or fecal retention. When the things are not going down, they start going back up. And one of the things which happens is fecal halitosis, meaning their breath smells like fecal matter, so they have bad smell. And when the things are not going down, they will develop kind of obstruction, abdominal distension, and the intestines are moving forward, intestines, to get rid of the poop. When they don't, they cannot do that, they causes abdominal cramps and pains. We see lots of kids in the ER, urgent care setting, with abdominal pain that show up, and when you do the x-ray, they have large amount of stools. So that is not an uncommon symptom. And when they have a lot of fecal matter in their abdomen pushing on the stomach upward, will cause anorexia or lack of food intake. The kids don't want to eat because of large amount of retained stools in their intestines. And we discussed earlier that the large amount of stools in the rectum can push the bladder neck, causing the urinary tract infections. And then there are psychosocial issues related to all this fecal retention. So 95% of the causes of constipation are just because of the things that I just discussed: lack of fiber intake, lack of hydration, and a painful experience like pain, severe diarrhea, local excoriation or damage of the anal sphincter or anal skin, bad diaper rash, child abuse. All these factors can compound. And lack of fiber and intake. Average American diet has 10 grams of fiber, while our ancestors in the past, they used to eat 50 to 100, and in the past even higher grams of fiber per day. So fiber or lack of fiber is the commonest reason of this functional fecal or stool retention, because our kids don't want to eat fruits and veggies. So it's very important to encourage that. Organic causes, like I said, are only 5% of all causes of constipation, which could be like a disease which is called Hirschsprung's disease, in which there is lack of nerve fibers in the rectum, because remember, nerve fibers cause stimulation of the muscles in the intestines to cause them to constrict and get rid of the stools. And if there is a local spinal injury or cancer, or abnormality, can cause paralysis of intestines. Medications like pain medicines, anyone had a painful procedure like tonsillectomy, they get hydrocodone, that can cause Tylenol with codeine can cause constipation. Sedatives, those kids who need diazepam or anxiolytics for their seizures or their anxiety disorders, can cause. low fiber feeding regimens in which the fiber is low, that can cause problems. Anatomical problems, developmentally at the time of birth, there is a narrowing, absence of the muscle, strictures are present, so the anus and the rectum, they don't have muscle in them, or intrauterine adhesions can happen, or your anus position is higher up, anterior displacement. Systemic diseases, if you have dehydration or celiac disease, dehydration if the child has had not loss of water, either vomiting, diarrhea, celiac in which you could be allergic to gluten part of the wheat, that can cause functional constipation or organic constipation. Other things could be like hypothyroidism, which is an endocrine disorder. Clinically, the vignette in the exams would show a kid who has a hoarse cry, pot belly, large tongue, and has constipation. All kids who have constipation should have a TSH or thyroid hormone level checked. Then cystic fibrosis, and the clue would be delayed passage of meconium. Meconium ileus in these kids can happen. Diabetes mellitus, again, it could be because of the dehydration or due to neuropathy because of poorly controlled diabetes. They can have paralysis. In DKA, they can have paralytic ileus, that can cause constipation. Kids with botulism happens if under age 12 months, under age 1 year, kids are fed on honey that has spores of Clostridium botulinum, and that causes nerve paralysis, descending nerve paralysis, and constipation could also happen. Lead in those people who live in old buildings. Remember, in vignette they will mention the old buildings. Lead level can tell you the cause of constipation. And then anorexia nervosa, kids are not eating as well. They are really those teenagers usually are worried about their body image, so they eat less. When they eat less, they drink less, they poop less. So that is a vicious circle leading to constipation. So in evaluation, the vignettes that will give you most importantly the history, delayed passage of meconium, breastfed child, or kids who is not eating fruits and veggies. All these causes would be the clue. Gluten enteropathy, anatomical problems, strictures, hypothyroidism we discussed, cystic fibrosis, diabetes, botulism. They will present you a kid who has paralysis as well, and there in the vignette it would be mentioned that the child is on honey and is under 12 months of age, so your degree of suspicion would lead to that. Lead toxicity would be another thing, and then the child or the teenager's growth chart is shown in which there is a loss of weight which is consistently happening. So these will be your clues in your vignettes, and then you will notice the organic clues which we discussed, and then their functional problems like with the toilet training. The parents are pushing the child to become toilet trained, and ultimately the opposite things happen. The child gets fearful of passing stool in that potty, and causes voluntary constriction of the anal sphincter, leading to constipation. Inappropriate training, like I discussed for the toilet training, and harshness or abuse can further aggravate the problem. And most importantly, in these kind of disorders, the growth of the child is going on normally. Diagnostic studies, are you can give barium enema, which excludes the Hertzsprung, in which the dye is passed from the anus upward. Rat tail sign would be seen because of the absence of the nerve fibers. Then endoscopy could be done. Biopsy of the intestinal wall can be carried out, and in biopsy you will see lack of nerve fibers. Manometric studies, in which you will have constriction of the lower segment of the rectum present in Hertzsprung's disease. So all these things will be helpful in isolating or in diagnosing the cause. For celiac disease, celiac panel could be done. BMP will tell us about the kidney function, calcium, sodium, potassium, electrolytes, glucose. So that could be done. TSH could be done. Celiac panel could be done for this to rule out organic causes of constipation. And most importantly, diet history is very important, to ask the parents how much fruits and veggies does the child eat on a daily basis. So how are we going to treat it? The treatment is very difficult at times, and the problem could be recurrent. So single most important thing to do is add fiber. But before we do fiber addition, most important, how to get rid of this hard ball of stools from the rectum. So enemas could be carried out, manual evacuation of the stools can be carried out. From the top, you can use go lightly. NG tube is passed and the child is admitted in the hospital, and go lightly is a chemical which liquefies the stools, breaks it down, and ultimately everything comes out, and this thing is continued until a clear fluid is coming out of the stool, or clear fluid in the fecal matter, so that everything has been cleared out. And then maintenance, Miralax or polyethylene glycol will be useful to prevent constipation. Magnesium salts have been used. Mineral oil in those kids who don't have the risk for aspiration pneumonia, meaning very young kids, could be used. Other things are like I said, enemas and manual evacuation. Diet, fiber intake should be increased. Sorbitol containing juices like prune juice can be added. Prunes themselves are good to relieve the constipation. But the most important thing which is commonly used is polyethylene glycol, or the over-the-counter Miralax. And the instructions or the dosage would be on the box that you can follow. And education is very important. A regular toilet regimen, that the child goes to bathroom first thing in the morning or mid-afternoon, late, whatever time suits, and the parent can even go in the toilet with the child, talk to them, distract the focus from stooling, so that the child is mentally relaxed. Negative reinforcements, harsh words, making fun of a child who is not toilet trained, or physical abuse or emotional abuse is not good for the child. Positive reinforcement, if they do stooling at the right time, praise them, give them a star, give them a present. That is really helpful. And individual and family counseling should be done, and explain to the family that having regular bowel habits, parents should not force it. It should be allowed. Add fiber, use Miralax, and continue to praise child. Allow the child to spend sufficient amount of time, because sometimes kids go in and out very quickly. They don't evacuate their bowels completely because they want to come out and play, which leads to some retention of stools, and then the vicious cycle keeps on building stools in the intestines. So that is very important. So in the nutshell, the behavioral modification, use of fiber intake, use of Miralax, magnesium salt, sometimes mineral oil can be used. Dulcolax is another medication which can be used. Extreme cases, you can use enemas, manual evacuation, or go lightly, which could be done in hospital via the NG tube. The go lightly fluid will liquefy the stools and get rid of it. Following that, you can use fiber intake, Miralax, to prevent. And functionally, if you are suspecting Hirschsprung's disease, barium enema, endoscopy, doing the rectal biopsy, manometric measurement of the pressures inside the intestines could be useful. But a continuous effort has to be done, because if you use the laxatives and stop them, the constipation will come back. So important thing is the fiber intake. Encourage the fiber intake, fruits and veggies, especially the green leafy vegetables like spinach, Apple a day could be useful. Pear, plum, watermelon, all these papaya, all these fruits will have cucumbers, broccoli, all these veggies, the green veggies would be really helpful in having daily bowel habits. Hopefully this high yield topic of pediatrics of constipation would have been helpful for you. For all the pediatricians, parents, please like and share this video and subscribe to my channel. Again, this is Dr. Babar from America. I'm a pediatrician and endocrinologist here. Best of luck. God bless us all. Assalamu alaikum.